Several digestive and abdominal abnormalities have been mentioned in this program. Tenderness over internal organs, such as the liver, spleen, or kidney, is always a cause for concern and should be reported immediately, along with any accompanying signs such as pain, fever, nausea, or vomiting. Document the location using the 4 quadrants. Rebound tenderness is also an adverse sign. Appendicitis is commonly accompanied by rebound tenderness. This is demonstrated by applying deep pressure onto a portion of the abdomen, then quickly releasing. If the patient experiences sudden severe pain on release, they have rebound tenderness. Testing for rebound tenderness should be done as the last step in the exam, as the pain may cause prolonged rigidity and guarding, making further examination difficult or impossible. A hernia results from a portion of an underlying structure, such as the intestine, protruding through the muscle fibers that make up the inner abdominal wall. Common areas for hernia include the umbilicus and the inguinal areas, but they can also occur at any point on the abdominal wall that is congenitally weak or has been weakened by injury or a large surgical incision. Irritable bowel syndrome may be evidenced by distension from gas, diarrhea, and bowel urgency. Other forms of the disorder cause constipation rather than diarrhea. Inability to form a regular pattern for bowel movements should be documented and reported for physician follow-up. Crohn's disease is an inflammatory bowel disorder that often manifests with persistent, severe diarrhea in the absence of infection or parasites, not infrequently accompanied by blood in the stool. Stress may exacerbate Crohn's, and it is known to be more prevalent in highly industrialized areas. The exact cause remains unknown, although some feel it is an autoimmune disorder. Colorectal cancer refers to cancer affecting the colon, rectum, and anus. It becomes more common as individuals age. Symptoms include bleeding, although often in small enough amounts to be undetectable except by occult blood testing. The current recommendation is that this be done annually, beginning at age 50. There are 4 tests that detect both cancer and polyps. The American Cancer Society recommends one of them be done at regular intervals on individuals 50 years of age or older. 3 of the tests are recommended at 5-year intervals. These are a flexible sigmoidoscopy, a double contrast barium enema, or a CT colonoscopy, known as a virtual colonoscopy. The 4th alternative is to have a colonoscopy every 10 years. Colonoscopy is also recommended if any of the other 3 tests are positive. With early detection, the rate of cure for colorectal cancer is very good. Cancers of the throat, esophagus, and stomach are often less symptomatic in the early stages and therefore more difficult to detect. Reports of frequent heartburn, stomach pain, vomiting of blood, and difficulty with swallowing should all be reported. The overall outcome for these cancers is not as good as for colorectal cancers. GERD, which stands for gastric esophageal reflux disease, results in frequent severe heartburn and acid reflux. It is known to cause esophageal erosion, sometimes leading to precancerous and cancerous lesions.